Can I come in? 20-second hand hygiene. Hi, Miss Smith. My name is Ca-Dao. I'll be your nurse today. I'm here to change the dressing of your central venous catheter insertion that's on your chest. Have you had this dressing change done before? Yes? Alright, perfect. Do you have any questions or concerns about it for me? No? Alright. First, can I have your wrist, please, so that I can see your wristband, and could you give me your name and date of birth? Alright, Kayla Smith, January 1st, 1970. Perfect, that matches what I have on record. Do you have any allergies, Miss Smith? Any allergies to chlorhexidine? No? Alright, do you have any pain anywhere on your chest, anywhere in your body? No? Okay. And this is for Linda. The patient is in an upright position that is ideal for a CVAD dressing change. Miss Smith, are you comfortable with where you're sitting at right now? Alright, perfect. I have one request of you. Could you move your head to face the wall? This is to prevent any breathing onto the site, to prevent any infection. And I'll let you know when you can turn back, alright? Okay, perfect. Thank you. Now I'm going to do hand hygiene. Put on a fresh pair of gloves. And now I'm going to wipe the table and the sides for 30 seconds. Alright, now I'm going to let the table sit for 2 minutes to let the solution soak and kill any bacteria that's on the table, and to also let the table dry. I'm also going to do hand hygiene again. And now I'm going to bring over the materials for the dressing change. I have my bio patch, my extra pair of sterile gloves, and my CVAD dressing change tray that I am going to now open. I'm going to take out the surgical mask, as my patient and I are both masked. Then I'm going to take out the sterile gloves, and now I'm going to drop in the bio patch. Throw away the packaging. I'm going to wash my hands once again and put on a pair of gloves. This is for Linda. I'm going to make sure that the tubing is clamped to ensure that no air embolism occurs. Alright, Miss Smith, I am going to start taking off the old dressing now. It's going to be a little sticky, so I'm going to go slow, but let me know if there's any pain or discomfort, okay? First, I'm going to look at the tubing to measure it, and it is about 5 inches, and I will take note of that. First, I'm going to take off the tape. Now I'm going to take off the dressing. How are you doing, Miss Smith? Any pain? No? Alright, perfect. And as I get closer to the insertion site, I will stabilize the tubing with my non-dominant hand. Throw away the Tegaderm. Now I'm going to take out the bio patch and throw that away as well. Now I'm going to look at the tubing once again and remeasure it. It is still 5 inches, which indicates that the tubing has not migrated since the last time I changed the dressing and since before I took off the old dressing. I'm going to look at the tube itself, and there's no cracking or leaking. The site has no signs or symptoms of infection. There's no redness, swelling, inflammation, or bleeding. Alright, Miss Smith, do you feel good right now? Any pain, discomfort? No? Alright, perfect. Let me take off these gloves. Wash my hands once again to start the sterile procedure. I'm going to throw away the paper. And now I'm going to take out the Ca-Dao and fold it back for easier access later. Alright, now I'm going to take the ChloroPrep and I'm going to activate it, make sure that the solution is coming out. Now I'm going to clean the site. Miss Smith, I'm going to clean the site, alright? Let me know if there's any pain or discomfort, okay? I'm going to grab the tubing with my non-dominant hand and clean a 2-inch border around the site for 30 seconds. Now I'm going to clean the tube itself on all 4 sides. Miss Smith, how are you feeling right now? Good? Alright, perfect. I'm going to let the site and tube dry for 30 seconds and I will throw away the ChloroPrep. And now I will be getting the bio patch with my clean hand. I'm going to hold the tubing with my non-dominant hand and pop the bio patch on. Now I'm going to grab the Ca-Dao and I will peel off the back with my non-dominant hand. And drop it. I'm going to position the tubing with my non-dominant hand and place on the Ca-Dao. Once the Ca-Dao is on, I can use both hands to secure it. Making sure that I do not press too hard on the actual insertion site. Now I'm going to slowly take off the border. Miss Smith, are you feeling any discomfort right now? No? Alright, perfect. We're almost done here. Alright, now I'm going to create a label for the dressing with my initials, date, and time. apply this onto the dressing for future shifts to know. And now I'm also going to label. Sorry, not label. I'm going to use tape to adhere the tubing to Miss Smith's chest so that nothing moves around. All right, now I'm going to start cleaning up. Taking off my gloves. Doing hand hygiene. All right, Miss Smith, I am done with the dressing change. You can turn around now. All right, so did you have any pain or discomfort during the dressing change? No? All right, perfect. I'm almost done here. I'm just going to need to document the process and I will come right back. I changed the CVAD dressing for Miss Smith on September 15, 10:50 a.m. She was able to tolerate it well with no pain or discomfort. The site of the catheter is does not have any signs of any infection, no redness, swelling, bleeding, drainage, or inflammation. The tubing itself is not cracked or leaking. There is no migration since it has stayed at 5 inches. The tubing itself is clamped to prevent any air embolism, and there is a Kuros cap on it as well. That is all for my documentation. All right, Miss Smith, I am done with the dressing change and the documentation. Do you have any further questions for me before I leave? No? All right. I'm going to make sure your bed is at the lowest position. You have your call light, your railing is up. And if you need anything, please feel free to use the call light and I'll be here to assist you. But other than that, I'm done. All right. So have a good morning and I'll see you later. Bye, Miss Smith.